You can't even stay close to someone wearing perfume or stand the smell of certain food and odors. Why do women experience a wave of symptoms during their early pregnancy? While some may have a smooth pregnancy ride, others experience a bumpy ride. In this video, I'll be unlocking all the signs pointing towards pregnancy even before a missed period. Hello Phenomenal viewers, welcome to my channel Get Value with Nurse Chinyere. In this channel, I discuss fertility and sexual health, and I break down every information into understandable bits. Kindly subscribe to this channel and watch other informative videos. For the brevity of time, let's dive into it. Symptoms that show up early during pregnancy are as a result of massive changes going on in the body system. There is a culprit everyone should hold responsible for making women go all over the place, and that is the hormone progesterone. First one is spotting or light bleeding, usually light pink or brown in color. This happens because the fertilized egg is trying to implant into the womb, that is trying to fix itself into the lining of the womb. You know, it will not just hang around, it will first of all attach to the womb so that it can be able to develop and grow well. When this happens, the blood vessels around that area that the egg has embedded will break down and show up as light bleeding. Another one is headache, often mild, comes and goes, that is intermittent in nature, but report to your healthcare provider if you feel very severe headache. Mild headache is triggered by hormonal fluctuations, increased blood volume. You know, during pregnancy, the body requires enough blood to help the mother and the developing baby. So the body has to increase his blood production. Stress and dehydration can also cause headache. Dehydration is when you don't take enough water. So you should try as much as possible to take water. I know it can be difficult to take water during pregnancy. You can try eating water-rich vegetables and fruits like cucumber, watermelon, orange, strawberry, grapes, etc., etc. Also, you can try to alter the water to taste better by adding a squeeze of lemon, lime or orange. You can also add fresh mint or a splash of juice. Just play around with flavors and at the same time get fluids into your body. I hope this helps. Another symptom is breast tenderness. The breast may feel sore, swollen or unimaginably sensitive to touch. This is as a result of increasing levels of progesterone and estrogen. These hormones stimulate the growth of milk ducts and glands in readiness for breastfeeding that follows birth. Another symptom worth mentioning is bloating and cramping. Bloating is just like accumulation of gas in your stomach, and cramping feels like that pain you feel during menstruation or ovulation. This happens because the embryo, that is the developing baby, is growing and the womb expands up into the abdomen to accommodate this growth. The next one is heightened sense of smell and taste. Like some smell becomes overly offensive. You can't even stay close to someone wearing perfume or stand the smell of certain food and odors. In addition, there is this metallic taste in your mouth. Literally everything you eat is tasteless, and you always want to dilute this taste, but you can't help it. You can try sucking on sugarless candies or chew gum. This might provide some sense of relief. Another symptom worth mentioning is fatigue. A dramatic rise in progesterone has a calming effect in the brain, acting as a natural sedative. That is why a pregnant woman feels sleepy and drained. Another one is frequent urination. The growing womb presses on the bladder. The anatomy of a woman, that is the way the inner makeup is structured, is in such a way that the uterus or the womb is in close proximity to the bladder. So the womb, which is expanding as the baby grows, will rest on the closest organ, which is the bladder. Any little urine in it will urge the woman to want to pass it out. That is why pregnant women often visit the toilet to pee. Another one is food cravings and aversion. Food cravings is just like developing likeness to some certain kind of food. And aversion is disliking food they used to like before taking in. Another one is constipation and diarrhea. Due to the increasing level of progesterone, it causes the smooth muscles of the bowel to become sluggish. Undigested food will take its time to be eliminated from the body, thereby causing constipation. While diarrhea is as a result of excessive bowel movement, any undigested food in it will leave the body as fast as possible. Sometimes it can be as a result of allergy to some certain kind of food. Before I mention the last one, kindly click on the subscribe button if you are yet to do so, and turn on your notification bell, because in my next video I'll be talking about indicators to show that a woman is having polycystic ovarian syndrome, that is PCOS. The last but not the least is nasal congestion, that is nose stuffiness. This is as a result of the tiny blood vessels in the nose swelling to accommodate the increasing blood volume. Remember that having any of these symptoms is not a clear sign that you are pregnant. The only definitive way to know is by carrying out pregnancy tests. These signs are just like pointers that will prompt you to go and check. This brings me to the end of this video, and I hope you find it very informative. Questions are welcomed in the comment section. Also subscribe, like and share my videos. See you all in my next one. Bye.